Good evening. This is Supervisor John Leopold, and I want to welcome you to tonight's telephone town hall. I really appreciate you taking the time. We're trying to provide information in a time that we can't all get together to try to find ways to provide information. I've been putting out a weekly newsletter, and if you're interested in that, you can go to the county website so you can sign up for that. You can also sign up on the Facebook page, Supervisor John Leopold, where I've been posting daily updates. I'll just say a couple things before we start tonight's meeting. As you may have seen this afternoon, a press release went out about the next shelter-in-place order that's going to be coming out. While the full shelter-in-place order is not out, they wanted to get information out to the public, both here in Santa Cruz and outside the county, about limitations that we're placing on beach activity. This is part of an overall attempt to reduce the number of visitors that we have here to Santa Cruz County. Although we have historically been welcoming to visitors, during the shelter-in-place, we're trying to get people to shelter-in-place in their own county and not in our county. So there will be increased enforcement at both our vacation rentals and hotels. The sheriff has been making calls to every vacation rental owner, and the hotels are going to be required to keep detailed information. If they're renting out rooms to anybody, they're going to have to prove that they're essential workers, healthcare workers or public safety workers, or someone here that's caring for someone who is ill. So we don't have a repeat of what happened last week. We are also going to be placing a closure on the beaches from 11 a.m. to 5 p.m. every day, starting on Friday. The water will still be open, and people will be allowed to walk on the beach to get to the water or to come out of the water, but you won't be allowed to be on the beach for any kind of activity during 11 to 5 hours. All the other times, you'll be allowed to be on the beach, but there will be no lying, sitting, standing, sunbathing, and they're not going to allow umbrellas, barbecues, coolers, beach chairs, shade structures, tents. It's supposed to be a place for active recreation, and we're going to, the sheriff will be out enforcing that and asking people to keep on moving, or if someone doesn't want to keep on moving, they will be cited for that. Lastly, we are going to be increasing the number of enforcement officers for the Live Oak parking program. We'll be doubling them this weekend. There'll be 3 on foot and 3 in the vehicles, and the parking lots at both Moran and the Hook will be closed. So I just wanted to share that information. I'm happy to talk about that as well. If you do have a question about this or tonight's conversation with Elissa Benson, you can hit star 41, and that raises your hand, and it tells us to unmute your phone so you can ask a question. Tonight we have Assistant County Administrative Officer Elissa Benson. Elissa has been with the county for 2.5 years, coming from several deputy director positions in Kings County, Washington. She has relatives in the area, and we're glad to have her on our staff. She has been organizing our efforts in our Emergency Operations Center to stand up our programs with the homeless here in Santa Cruz County. She's been doing that since before the COVID crisis, but with the COVID crisis, it's real clear that we are working to prevent the spread of COVID within the community of people experiencing homelessness. So tonight we're going to talk about that. We're welcome to talk about any other things, but I want to introduce Elissa and ask her to talk about her work, and then we'll open it up for questions. Good evening, Elissa.
Thank you, Supervisor Leopold. As John mentioned, my name is Elissa Benson. I work within the County Administrative Office. But these days, I am detailed to our Operations Center out of our Human Services Department. That's where our work around shelter and care resides during this public health emergency. I am very fortunate to work with some great partners there to work towards addressing the COVID-19 situation within the homeless community here in our county. I want to give a little bit of a context of how this works in an emergency situation. As the supervisor mentioned, my day job, I work on homelessness, and it's kind of organized differently. In this situation, our direction and marching orders really come from the public health officer, Dr. Gail Newell. She really sets the goals that guide our development of strategies on the ground. So I'm going to kind of give you that big picture before I talk about what we've done here in the community. So from that public health direction, the four main goals really can be boiled down to minimizing death from the disease, mitigating or preventing and mitigating spread of the disease, really preserving our healthcare capacity and having it ready as the disease moves through our community, and then really trying to make sure we have quality information both for the general public, for providers that are involved in response, and for folks like people experiencing homelessness who might have a different experience with this pandemic than those of us who are housed. So those four sort of objectives really drive our operational strategies on the ground. So when you get to our shelter and care task force, that's what we call ourselves. First, I want to say a little bit who it is. It is a interdepartmental group from county staff, but it also includes partners from our city jurisdictions, from our community-based organizations who are literally doing that work with homeless populations every day. So we're all come together in one team to really plan our response and make sure we're doing the best work we can. As you can imagine, doing anything during this period has been challenging, but we've all worked very diligently to figure out how to get stuff done. So that's the who. As we look at our response, really it comes down to three main objectives. And the first one is to provide shelter and care infrastructure for our highest risk groups of people experiencing homelessness. And we use the acronym PEH, people experiencing homelessness, typically just to describe the population we're serving. The next objective is to expand 24/7 shelter to comply, for PEH, to comply with the health officer's order to shelter in place. And then the third objective is to increase service and engagement to people who are homeless, who are outside of our system and living in encampments and vehicles and trying to figure out how to best support those folks to be safe and mitigate spread of the disease. I do want to start by sharing that to date, we have not had any homeless community members test positive for COVID. Now, we all recognize there's limitations in that statement given the degree of testing that we've been able to do, because it's all been through healthcare referral to this point for people who are symptomatic. But just so you know, even when we've had symptomatic homeless folks, those tests have been negative so far. So we've been very fortunate in our community that it has not affected this very vulnerable group that lives here in the county. So as we've plotted forward our strategy, we really focus on the highest risks as determined by that question of have people been exposed and their underlying vulnerability, and then that ability to shelter in place. And as we've come forward with these strategies, we've really locating our response across the county. And I'll talk a little bit more about the facilities that we've stood up, and they've really been from north to south, east to west, to really make them accessible, size appropriate, as you can imagine. We're trying to keep the number of people congregating small, and just really that shared responsibility of us as a region to this emergency. So our four-part strategy really rolls back to that question of highest risk. And as we started this work in late March, we started with that immediate issue of that question of, Do we have homeless people who are COVID positive or COVID exposed, and unlike those of us who are housed, have no place to quarantine or isolate safely? And what that meant was we then moved towards, you all probably heard Governor Newsom's original announcement of funding for cities and counties to pursue hotel capacity so folks could shelter individually and not in what you'll hear me describe, congregate living situation. So this is to allow them non-congregate private space to have available if they need to isolate or quarantine. And we call that our IQV, Isolation, Quarantine, and Vulnerable Shelter. That also includes the folks who, the vulnerable category are people who are age 65 and older, just like folks who are sheltering in place who are housed, as well as folks who are medically vulnerable with some underlying medical condition. So what that has meant is we are able to leverage FEMA funding as well as a contribution from the state to offer this IQV shelter. And we opened our first IQV shelter in early April. It had about 28 rooms. We provided 20 of those rooms through a referral system for people who were 65 and older, who were homeless, or had medical vulnerabilities. As you can imagine, those rooms got filled very, very quickly, and we have a waiting list for folks who fit that category. We actually today opened our second IQV shelter, and that's a shelter with about 38 capacity, and we will be moving more of that vulnerable population in. All the time as we open this particular type of shelter, we are mindful of that we need to keep capacity available for in the event that we have folks who are COVID positive who need to isolate, or folks who are exposed to COVID and need a place to quarantine. So we have a third property coming online next week. So these are all hotels who reached out to the county and interested in participating in the program. And so we worked through leasing agreements with them and then creating all the services around supporting people in those facilities, from food and laundry and medical care, to help them to be able to shelter in place. We have a fourth site. We're working in Watsonville to have a site down in South County as well to help, again, those vulnerable people experiencing homelessness to have this option. The next portion of our strategy was to look at the risk of COVID within our existing shelter system. And so in that instance, the key issues were their ability to implement social distancing in a shelter model. What that meant was moving people apart, creating different protocols around food and hygiene. So we had a team that worked with every shelter to first make sure they had the right information, and then we had our environmental health inspectors and our public health nurses go to shelters to help our providers actually understand and make sure they're implementing that guidance effectively. The downside and unavoidable consequence of that meant we couldn't implement the physical distancing and maintain the same level of capacity in those shelters. So to actually get the numbers to where they needed to be to physical distance, we had to find more expanded shelter space, which led to our third part of our strategy, which is expanding shelter across the county. And since we initiated this in early April, we've been able to expand our operations to 3 different congregate sites in addition to the 2 IQV shelters I've already talked about. So we have opened an expanded shelter. These are 24/7 in the city of Santa Cruz at the Santa Cruz Vets Memorial Hall. That opened in early April. On April 16th, we opened another similar shelter in the city of Watsonville at the Watsonville Vets Hall Memorial Vets Hall. That And then we opened mid-county at Simpkins a shelter that is specifically for transition-age youth. And then we're continuing to expand, looking at use of the fairgrounds and other locations across the county as we need to provide additional shelter. I should also point out we have our alternate care site, which is not specific to homeless, but this is to address overflow if in a surge, in the predicted surge in terms of hospital need. That site is in Scotts Valley, and I think some folks have probably already been familiarized with that. So at the expanded shelters, these are 24/7 shelters. And I should point out that a lot of our existing programs do not provide for 24/7 services. So that's been another factor that we've had to address in trying to come up with ways where homeless people can shelter in place. I myself have visited several of the shelters that we've opened, and talking with the guests there who have been part of our emergency shelter system, so have a safe place to sleep at night, were quite surprised and relieved when they didn't have to find another place to go during the day. As you can imagine, with the closure of so many facilities that typically where folks would go, whether it's libraries or cafes, and many of our day programs, this has been a challenge for people who are living outside. And the gratitude that I felt from these folks when they were told, no, you can be here, this is why we've opened up these shelters, was pretty amazing to see. The fourth part of our strategy, because we recognize, given our homeless population, it was very, very difficult to be able to provide shelter for everyone, is really around those who are living outside still, either in cars or encampments. Our approach to this has been guided by basically directions from the Center for Disease Control, where they really start from a premise of, for homeless people who are living outside in tents or vehicles, the fact that they are not part of a larger congregate group is actually in their favor in terms of staying safe from COVID. So the direction is to support folks who are living outside if they are able to shelter in place safely through additional services and information. So this fourth part of our strategy has been, how do we get information to people living outside about physical distancing, about face coverings, about medical care and screening? Homeless people have different information pathways than folks who are housed, so that it's been very important to make sure they have adequate information about the disease. So to that end, we've started a number of different strategies. One about what we're calling pop-up engagement stations. And we have 4 of those located currently, several in Santa Cruz, one at the Emmeline campus here where we have a lot of our health and human services, one at Depot Park in the city, we're looking at to open one in Watsonville at the county campus there, where we have a number of health services that are frequented by people who are experiencing homelessness, as well as on the Pajaro Levee, where we do our pop-up outreach out there. We're also looking to have a much even greater focus on outreach and engagement in some of our major encampment areas, and that would be at Coral Street here in the city of Santa Cruz. And then actually right behind the government building here at 701 Ocean, where we have a growing number of campers in the benchlands at San Lorenzo Park. So again, in alignment with that CDC guidance, we are trying to help these folks shelter safely in place, make sure they're doing appropriate social distancing of their tents, and getting them appropriate hygiene and sanitation facilities. lastly, I guess I would want to put out there that we have, in this effort, been able to also develop a single point of contact for shelter referral. So prior to now, folks had to approach getting shelter at each, basically go to see if they were open at different shelters, and we didn't have a single point of contact. We now have that, and that now is the point of entry for any of these shelter systems. And I can make sure Supervisor Leopold has access to that information. Those referrals are coming from service providers, but they're also, it's numbers that if someone is experiencing homelessness or you know someone who is experiencing homelessness, they can call and get connected with services. So
that's great. That's really great.
I'd be happy to take any questions.
Yeah, that's a very thorough understanding of all we're doing, and I think it's a part of our effort that everybody's trying to do their part to reduce the spread of transmission of this virus, and the county taking very seriously one of the segments of the community that needs support in order to ensure that not only are they safe, but that we're all safe, because when you have a virus, it doesn't make a difference what community starts it. It can spread to any other part of the community. I want to give people a chance to ask questions. If you want to ask a question, you can raise your hand by hitting star 41. And if someone asks your question, you don't need to ask a question. You can hit star 42. But if you want to ask a question, hit star 41. And why don't we go to our first person? Good
Hello,
evening.
can you guys hear me?
Yeah. We can hear you.
How's it going? I don't have a question directly for her. This is Jackie. I had one encompassing the overcrowding of the beaches, and I saw that new ordinance you guys launched for that. I had a couple ideas of seeing if they've been kicked around.
So if you can be brief, share them. That'd be great.
Yeah, absolutely. Is it possible to ID people when you're selling the day beach permits to cut down on the people coming from out of town for the day? Because most of the locals have gotten their passes for the Live Oak Pass. But is there a way to, where they're selling the day permits, check their ID to make sure they live in the county to keep the numbers down?
Sure. If there's a couple things you just want to get out, that now would be the time, because we're gonna mute you when I start talking.
I did mute them. Sorry, I can unmute them if they have another question. Hold on. I just unmuted them
again. Did you want me to repeat the question?
Was there anything else you had to ask?
Oh yeah, and kind of a two-part to that. That would probably help that problem, as well as, is there any way, due to the overcrowding around the Pleasure Point area, West Cliff area, to have more police presence where they would be IDing people at random, just to also cut down on the people coming from out of town? Because yes, there is a lot of locals, but there's more people from out of town than on normal holidays.
Yeah. Okay. Well, thank you for both questions. We've had a lot of conversations about this, and we've taken to mind both what is going to be effective and enforceable, and what is sustainable. And I get a lot of requests every day about barricading Highway 17 or the roads into Santa Cruz County, which we are not allowed to do. And I've talked at some length with our sheriff about the idea of setting some limit in terms of miles or car registrations, etc. And it's a very difficult thing to enforce, to be able to make a difference between you, me, and the next person as to who's a resident and who's not. So imagine being down at the beach and you're getting ready to go in and surf, and someone says, "Where are you from? Let me see your ID." Most surfers do not carry their ID with them when they're going to go surf. So we're trying to figure out other strategies that we can prevent people from being here that are enforceable and sustainable over time. We are going to have more enforcement of the parking program, and as I mentioned earlier, we're going to be closing the parking lot to help deal with some of the issues in the Pleasure Point area. We think that by closing the beaches from 11 a.m. to 5 p.m., that will make it less attractive for people to come over during the day or to come over here overnight, and especially with the also doing stricter enforcement of the vacation rentals and hotels. That will play a big role in it. We see this as a possibility to evolve over time. If we see that this isn't working, we're going to continue to step it up until we figure out the right mix. But we don't want to start with the most severe pieces because it places the officers in an uncomfortable position about asking people for their papers. And we're trying to avoid that if we can. We go to it as a final measure. But we've talked about it at some length. So we're going to try this next version of it, and we'll keep on fine-tuning it to get it right. How about another question? If you want to ask a question, hit star 41 to ask a question. Good evening.
Hi. I'm asking, I'd like to ask some questions about unhoused community. First of all, I have several questions. I'll try to make them really quick. But one of them is, are you enforcing, which I hope not, people that are unhoused in the streets to move along to, if they don't have any people, that they're not keeping social distancing, because a lot of people are in groups, they know their friends, that's how they live. So that's one question. How are you handling the people that are living outside? The other one, I don't see any face masks being provided. The bathrooms are not being maintained. They're missing toilet paper, no water. So is PPE being provided? And how many people that are unhoused been tested? You had to. The last question is, you took the shelters and made it less people so that it created more social distancing, which is great. But then you went and put them. You put them in different places like the Vets Hall, but then did people from the outside, other than maybe 28 rooms, get put into the different rooms, or did those people come from the shelters? So,
Sure.
and project room,
let's try to get this.
aren't we using more of project room key? Thanks.
Okay, well, let's try to answer some of the questions. Some of them Elissa may be able to answer, and some that I will try. At least what I heard is, are we making people move along if they're in groups or in their encampments, if they're out there? Trying to think of the second question.
I think it was access to hygiene.
Oh yeah, access to hygiene, and then if we reduce the number of people in the shelters, are those the people filling up the rooms, or are there other places? And so you want to take a stab at some of those, and I'll try to answer some of those if you can answer.
I sure can. So a good question around that issue of enforcing social distancing with folks who are living outside. In general, no. I mean, I don't think we're doing that. What we're trying to do through our engagement program is talking to people about that. And one of the things, and I appreciate that you recognize it's a different experience if you're unhoused than if you're housed. So to the extent that folks are, that is what's kind of their natural cohort, and they're already exposed, our recommendation is then you guys need to sort of stay together. But you have to sort of, interact. When you interact with other folks, you want to maintain that social distancing. In terms of hygiene, I think that we are deploying a lot of porta potties and hand washing stations. As you can imagine, it's actually been harder to get our hands on those than we would have liked, just given that everyone is needing them. But we are getting those out, and I have to see, and I can get this to Supervisor Leopold, a map of where they are. We're trying to do that so people know where they are. Servicing is always an issue, but we're doing our best. In terms of the impact of moving folks from overcrowded shelters into the expanded shelters. First, one thing I did not talk about in our expanded shelter model, we are doing something a little bit different, which is it's a tent-based model. So everyone has their own space, a little, a tent for them to have, which one, it's what we want to do from just a social distancing perspective, but also people appreciate having a little privacy. So we are doing that. Yes, we did first address the congestion in existing shelters in relocating people, but then the capacity beyond that was part of the referral system. And when we referred people into the Project Room Key rooms, some of those did come out of the shelter system, and rightly, these are folks who were in a congregate living situation and more vulnerable due to either medical conditions or age, so they moved in. But now as we've opened this second site today, we're moving more people off the referral list. Actually, I know someone, we got a heads up of an elderly woman, living outside, who I guess had reached out, but we did not have the capacity, and she was just given a hotel room today. So I think I hit on everything. John, is there anything you would want to add?
No, I think that covers it. I think that we're not done providing shelter space. There's still continued efforts to expand the number of spaces. And we're also trying to expand the number of hotel rooms by working with local hotels. We can't force them to take them, but we have to negotiate with them. And I know Lisa and her crew are doing just that. If you want to ask a question, please hit star 41, and we'll try to get to you tonight. And if we can't get to you tonight, we will. You can always email us, and we'll respond. Good evening.
Hello, can you hear me?
Yeah, we can hear you.
Okay, my name is Gray. I just had a few points that I haven't heard really answered before. The one of them is the pop-up engagement centers. I don't see those in SoCal or Aptos. I didn't know about those either. And Food Not Bombs, I go there to eat, which is a big help. But I don't see that would be a good place for information. The other thing, the bathrooms, the county bathrooms that have been locked up, I'm one that thinks about the car people or the homeless people or the older people walking by, and those have been locked up. I don't think it's a good idea. I didn't know what you were doing on that. The other thing is the single shelter referral. I would like the phone number for that too. That's the three main things: bathrooms, the areas. Oh, and also with the information centers, Food Not Bombs. I don't know if you guys support them, but it seems like they get a lot of flack from the city. So it's the bathrooms, the pop-up engagement centers, and the number for the shelter referral. Thank you.
Okay, thank you, Gray. Do you want to address that, Elissa, about, I can say about the closing of the county bathrooms. We did that at all the parks because we were not able to clean them well enough on a regular basis to ensure that they would not be vectors for transmission of the virus. And I think you'll see that in a lot of places throughout the state where they've closed public bathrooms. It's not something we like to do, but we're trying to prevent the spread. Do you want to talk about pop-up services in the Mid-County, or if you know the phone number to share?
Sure. Let me first give you the phone number. It is 291-5098. That is, we have someone with that, picking up that number 7 days a week, 8 to 7 every day. In terms of pop-up outreach Mid-County, I will talk with our team about locations for that. If you might want to if there's particular places that you think that would be helpful, we'd love to hear about it, and I'm happy to, provide my email if people would like my email to send that, if that's a possibility. Or you can follow up with me by calling 454-2100, and they will get you to me. And we can talk about options for mid-county pop-up engagement.
Well, it's not too often the assistant CAO gives out her phone number to people she doesn't know, so take that as a very generous offer from Assistant CAO Elissa Benson. I want to make sure to get to everybody's questions. Star 41 if you have a question. Why don't we unmute another person?
Oh, hi. Thank you so much for all this information, and thank you, Santa Cruz County, for moving a mountain in a matter of weeks. I mean, I'm just astounded by the amount of collaboration and outreach that would have taken years of getting me to get done. So I just had one question that's been asked of me, of people experiencing homelessness, is, well, how long are we going to be able to stay here? And when do you, and that's the great $10 million question, right, is I saw Dr. Mimi Hall's talking about the SAVES program, about like a 12, 18-month, 24-month program. So is there any estimation on how the timeline for allowing people to shelter where they are in their encampments, and when that might change? And then my other question is, if you have any access to the amazing work being done to make thousands and thousands of masks, yeah, that'd be just a great thing to channel to the pop-up site.
Sure. All right. Well, Elissa, how long will these shelters be up?
I don't even know. I mean, we are hearing those same numbers, but we're not sure what that means in terms of our program. Right now we've been so focused on trying to get additional resources out there, but we also recognize, what's going to be sustainable over time, and we want to, what can we leverage, what can we continue, and what are we going to have to figure out a different way how to address. Here at the county, prior to COVID, we were really, really actively pursuing and working with the other jurisdictions on trying to develop a navigation center strategy that's sort of a full-service shelter. We want to get back to that, so we do have some assets, after the event. But I really can't tell you. I mean, we are so thrilled that we are able to provide more shelter for people at this point, but we want this not to be a temporary thing, and we've got to figure out what that transition will look like. I really appreciate your comment about the masks, because I think that was actually one of the other callers' questions. It's absolutely prior to the the facial covering order that Dr. Newell issued last Friday, we had not been looking at providing face masks or facial covering as part of our outreach and engagement, and we did want to start pursuing that within the shelters, just again for that level of what are we calling prevention. People are saying those masks aren't protecting you, but it's keeping our germs to ourselves and hopefully limiting the spread if we do have people that are asymptomatic. We are working diligently to, one, get those facial coverings distributed throughout our shelter system, and really, helping people adopt this new social norm of wearing them, which is difficult sometimes. But I will actually take that in all the meetings I'm in on this, I have not heard my public health team who's working on the outreach talk about facial coverings, but that's probably because it's just so obvious to them. We do work with our Emergency Operations Center, who are working with the community mask making that's happening. So whether it's those, or we did order 5,000 bandanas to try and get out to people. We are working on that in the sort of, follow-up to the facial covering order of last week.
Great. And it's also a chance to plug that the county is accepting donations of PPE. If you go to the special county website about COVID at santacruzhealth.org/coronavirus, it has information about how you can donate, and there's also information there that we will provide material for you to make masks. The city of Santa Cruz and both the county of Santa Cruz are working to help people make masks so we can share them with as many people as possible. If you want to ask a question, it's star 41 for a question. I'm going to get the next one. Good evening.
Hello, is it
If you could just share your name, that would be great. Good evening. We can hear you.
Oh, hi. I wasn't sure I was on. Thank you very much for this session. I just wanted to make a couple of remarks, and then I'll jump off. First of all, I have heard from others that if we close the county lines and do not permit people to come into our county, then that the same applies to us, that we will be restricted from leaving our county, and that would be a real problem for so many people who are still commuting from Santa Cruz to other places. So I don't know if you know anything about that, Supervisor Leopold, or not,
Sure.
but this is something I've heard. Second, I live on the west side, about half a block from West Cliff Drive, and we have noticed in our neighborhood, we have visitors coming all day long, coming and going, locals, surfers, fishermen, families, and it's a very nice environment. However, with the closing of the parking lots, that has pushed a lot of parking into our neighborhoods. And with the closing of the bathrooms, I have to tell you, on any given day, just looking out my window, I will see somebody piddling in the gutter, hiding behind their car. So I wish that the county could rethink the closed amenities that are needed not only by the visitor to continue to come to Santa Cruz, but by our local people, and in particular our local PEH population, persons experiencing homelessness. Then if I could just close with a remark for Elissa.
Very briefly.
Really happy. Yes, I'm delighted to hear the detailed report of all that your department is doing. You've been handling the immediate pressures of this admirably, and I know we have an unclear horizon on what's going to happen, but please, as you are instituting these solutions for people experiencing homeless, please consider the sustainability. We need sustainability. Once we have a vaccine and the virus goes away, we still have a homeless population that is in need of services, housing, and dignity. So I thank you for your work. One last quick thing. Please consider sanitation for the homeless.
Who have other hands up. So let me try to get to your question.
Please consider dumpsters for the homeless. They don't like to leave trash. Thank you.
Thank you. I don't mean to cut you off. I just want to make sure we get to everybody in the limited time we have together. The question of closing the county lines, we could only close off the county to others through a countywide quarantine, which is not done by our health officer. It has to be done by the state health officer. And if we did that, we would be able to keep people out, but we would also not be able to leave. And so we have not considered that in any way, shape, or form, although many people have suggested it. And the question about public facilities is a difficult one, about what role we play in the transmission of the virus. And so we've made a decision to close the public facilities, as many places have, because we cannot clean them well enough to maintain them and ensure that they're not contributing to the spread of the virus. And so we are hoping that people can be responsible, and it's a shame that people who visit our community can't respect it enough to find another place if they have to go to the bathroom. And we are, of course, looking at our long-term strategies around meeting the needs of people experiencing homelessness in Santa Cruz County. That has been an ongoing effort. Elissa's been leading a team an interdepartmental team, both within the county and with all the jurisdictions, that was well underway before this crisis. But this crisis has sharpened it and put it into place very quickly. I want to make sure to get to everybody's question. We have about 15 minutes left. If you have a question, hit star 41. And just if you could give us your name before you ask a question, it's always nice to know who we're talking to. Good evening.
Yeah, hi, this is Larry. And I always walk my dogs on weekends over by the Simpkins Swim Center, and a lot of other people do too. Well, this last weekend when we were there was used needles, used condoms everywhere like you don't normally see around there. And I brought this up to a security guard that was sitting in his car in the parking lot, and that's when he told me what the swim center was being used for now, and that the people staying there, they had free reign to come and go as they please and basically do whatever they want. There was nothing that he could do about it. I'm not going to go back there anymore, and I was just wondering what your comment might be to that.
Elissa, so the concern that using the Simpkins Center as a shelter has contributed to needle waste in the community.
Well, thank you for bringing that forward. I think what I would want to do with that information, first I want to clarify the shelter policies that we're opening. These are shelter-in-place programs. The expectation is people are staying there, but they do have the ability to leave the shelter for essential activities, and that does include going outside to walk around and recreate, just like any of us. But that is a concern that you raise, and I appreciate that feedback, and I will take it back to the shelter manager to discuss that this was raised. And I am concerned that that was the perspective of the security officer, that potentially this person is observing harmful behaviors and things that are not appropriate with what we are expecting from the people participating in the program. So I do appreciate the information, and I will have a conversation with the shelter manager about what you shared.
Yeah, it'd be nice to check to make sure that we could definitely tie to the people in the shelter. We know that people come and go, but if there's information that they're contributing to problems in the neighborhood, we'll want to know that right away and deal with it at the shelter. Let's see if we can get a couple more questions in. Good evening. Hi. Is anyone there?
Wireless caller. Go ahead.
I'm here, but I don't know if anybody hears me.
We can hear you. What's your name and what's your question?
Elaine. Yeah.
What's your question?
I had okay, my question was, I'm on Glen Canyon Road, and when I'm driving out, like going to town or whatever, I see people parked along Branciforte, and usually they're in a car or a travel trailer or some kind of a thing. So are you trying to, I didn't understand, like people that are homeless in vehicles, are you trying to reach them and give them some kind of service? And if you are, I mean, should I stop and say, hey, do you know about this service that's available to you or whatever? I mean, are we trying to reach all the people that are parked along the sides of the roads, or we're not? We're just letting them do what they do.
All right. Well, thank you, Elaine. Good to hear from you. Miss seeing you. Elissa, for people who are parked on the side of the road, what should be how can people help those folks?
Thank you for that. I think what we're trying to do is, one, not ask them to leave, but have people, as I said, shelter in place. What I can do with that information, and I don't think Branciforte, and I know the zone you're talking about, has been a place where we have done any pop-up outreach. As I said, we've been a little more focused on folks who are living outside and don't even have the protection of a vehicle. But I think what we want to start doing is, as we can, and again, this is around that risk question, right? If there are areas where we're seeing, we want to make sure people have access to the information, and I can share with our outreach team, that this is another site we need to put on our list, just to go and start those conversations about health, about what they need to know about the disease, about what to do if they are symptomatic, and how to, who they should be accessing and calling, and what's available to them in those situations. So I appreciate the reminder of the different areas where we see this. Lots of people who are experiencing homelessness try to stay invisible. So appreciate that, and I'll take that to our team.
Great. We have a couple more questions. I just want to let people know that next Wednesday, Congressman Jimmy Panetta will be joining me to talk about what the federal government's doing to assist us during this COVID crisis. I want to make sure we get to a couple more questions here before the end of the hour. If you could give us your name and your question.
Hi, my name is Lisa, and I have a question about I'm not surprised that there are restrictions on the beach now, because I saw a ton of people last night walking around just like all over the place. So it doesn't surprise me at all. My question is, so you can go directly to the water to surf. Can you go down to the water line and just walk along the beach, or is that forbidden too now?
During the hours of 11 to 5, you can't just walk along the beach. You either have to be going into the water or coming out of the water. Other than that, it'll be closed. We want to keep the beaches open during times that locals can use it, and that's why it's only 11 to 5. And we're hopeful that gives a chance for our community to access the resource and be discouraging for out-of-area folks from coming here. So thank you, Lisa. We have time for a couple more questions. If you give us your name and your questions.
Is it my turn?
Oh.
Can you hear me?
Yeah.
Oh, great. I already asked a question before. My name's Abby.
Oh, okay.
I have a map, a Google map of all the bathrooms. I can print it out and forward it to you. If you can tell me
sure, send it to our
address.
office. I'd love to see it.
And just a couple small questions. Where is the second site? How many people have been tested that are unhoused? And Watsonville, you may know this, but I work with the unhoused people a lot, and people that get moved get an apartment, a little room over in Watsonville. They're missing all what they know, their life here as they know it, and they end up leaving their place and coming back to Santa Cruz. So that's usually Watsonville doesn't always work for Santa Cruz.
You want to know if there's an additional site and if they're and what are we doing to help folks who are being housed in a community that's not their own?
Right. And
Elissa, maybe you want to try to answer those questions.
Sure. So as I mentioned, we did start an expanded shelter at the Watsonville Hall, and I will say that particular facility, it did not. We did not use it for folks who are coming out of to address congestion in existing shelters in South County. It actually went straight to folks on the waiting list. So we are, and it is at its initial capacity. And I will say it was a really challenging moment when our team who's working down there said they had 20 to 30 people come and knock on the door and wonder if there was more shelter capacity available. So we know we need to do more in South County and understand that. In terms of, I don't have a number of how many homeless people have been tested because, as you know, there's not mass testing. The approach at this point has been if people are symptomatic and their doctors refer them for testing, then they are tested. So there's not a way to assess at this point without the mass testing capacity that I think we're all waiting for to understand the level of exposure within the homeless community. So I think I answered your questions, but I hope that
you got them. You got them. And I'll just say that we're looking forward to the day that we have more robust testing. We know that needs to be happening. We're fortunate that people are not showing up at the emergency room with that are very sick. So we think that there's not terrible spread through here, but we will only know when we do more testing, and that's testing of everyone. We have time for maybe one more question. If you give us your name and your question.
Yeah, my name is Eric Johnson, and I live in Pleasure Point, and I just wanted to really get a good understanding. This question's for John. How do you reconcile having a law, or I don't even know if it's a law, but the shelter in place, and not being able to actually enforce it? Because it appears as though there's no, I've heard, and again, this is just hearsay, but apparently sheriffs aren't allowed to ask for IDs. So people are still coming into the county, possibly bringing COVID, but there's no way to enforce it. Is that correct?
Well, so the way that the statewide order is written, people have interpreted that could be a way in which you could stop people from moving place to place. We're not aware of many other places that are doing that. We have talked about trying to create some certain miles that you can only go to allow people in Santa Cruz to enjoy our coastline, but just people in Santa Cruz. There are some constitutional questions that need to be answered, and there were some concerns from the sheriff about whether all of his officers will be able to enforce it. So we decided to go with the strategy we have now to see if that addresses the problem. Combine the beach strategy, the hotel and Airbnb strategy. We're going to be doing a communications campaign outside the county and our parking restrictions. And we will keep on changing if they are not giving us the results that we want. But we're trying to do this. We're all in uncharted territory here as we try to keep people in their close to home. But it's not an easy thing to just start asking people for paper, especially when they're going to be in a situation where they're unlikely to be carrying their ID. So just see this as evolving over time if we need to make changes based on these new orders. I want to thank Elissa Benson for being on tonight's call. She does hard work each and every day, and during this crisis, she is among our leadership who is spending countless hours trying to address a critical need in our community and prevent the spread of COVID-19. Through her work, not only will we help keep us all healthy, but hopefully this provides the framework necessary for us to have the most effective strategy to address the issues of people experiencing homelessness in Santa Cruz County. Thank you for your work, Elissa, and thank you all for joining me this evening.